Namaste. I am going to speak on holistic approach to symptom management. The faculty for this topic is Dr. Preeti Sanghvi. She is professor and head of the Department of Pain and Palliative Medicine at Gujarat Cancer and Research Institute, Ahmedabad. She is also vice president of Gujarat chapter of National Association for Palliative Care for Ayush and Integrative Medicine. Why there should be holistic approach to symptom management in patients who are on palliative care? Firstly, these patients are suffering from chronic illnesses and it is a very complex process. This chronic illnesses is not affecting only the physical aspect of their life, but it is also affecting the psychological, social, financial and spiritual aspect of their life. The symptoms in these patients may be because of the underlying disease, side effects of the treatment, multiple medicine or drug therapy they are receiving. It may be because of the psychological issues like anxiety, fear. The symptom may be because of the social issue like caregiver's issue. Caregiver is not paying any attention to patient and patient is in distress, or spiritual issue. If patient has done something wrong in his life and now he is feeling guilty that because of that wrong thing he did in life, he is suffering. Hence, this symptom management in this patient needs to be addressed by holistic approach. How we are going to plan the caring of this patient? First of all, evaluate the medical condition of the patient, then set the goal of the care. What is the goal of the care in this patient? Whether goal is to cure the disease, goal is to just palliative care, goal is to give only comfort, etc. In this planning, you always involve family and caregiver, or if patient does not have any family member as a caregiver, he might have hired a professional caregiver and then involve them. They should be part of the team. Evaluate patients' physical, psychological, social, existential and their understanding about the disease and communication etc. So, evaluate patient's side of this. Evaluate family issues also similarly, again physical, psychological, existential, social and understanding. Evaluate the coping assessment of patient, family and professional staff, and evaluate the contingent planning. What are the intervention will be planned, the available resources, how patient is going to afford it financially, etc. So, before planning any care, you have to evaluate all these points as far as patient and caregiver is concerned. As I said, goals of care. Your aim is to prolong the survival of the patient, or just to optimize the comfort of the patient, or to optimize the function, his ability to do routine work as far as possible. Goal of the care will also depend on the different treatment option and its benefit, whether you want to treat it aggressively by doing lots of intervention. You have to find out the benefits and drawbacks of the same and take the decision. You should always discuss all this honestly about the treatment and its outcome with the patient and family. You should not add any adverse effect or any burden because of your treatment. Like as I said, patient coming with the symptom of vomiting, vomiting can be treated at home or it may be hospitalized and can be given injection in hospital. So, you have to see whether he is capable of hospitalization, capable of traveling, capable of undergoing investigation, and you have to set the goal accordingly. And we also have to discuss what will be the outcome if no treatment is given. So, principle of symptom management, that ensure the patient centered treatment decision. Always keep the patient in center, he is the focus. You have to take patient's view in consideration, patient consent, patient understanding and patient's decision into the consideration. Create a safe place to express suffering, relationship. You build up the rapport with the patient. So, he should be able to express his suffering, his feelings, his view with you, and we should be able to discuss openly with you. You should take enough interest in listening to their problem, listening to their symptoms, and sometimes you observe the patient and take a note down the symptoms instead of asking the patient. Good open communication. Open communication means how you are feeling. So, that he has got ample opportunity to describe any problem he has. Instead of asking how is your pain, then he will describe only his pain, that is called close question. Select proper words. Response to treatment may be misinterpreted as cure. So, do not say that we will cure your symptoms, we will try to control your symptoms and we will see response to the treatment. Always discuss the impact of treatment on quality of life, whether your treatment is going to improve the quality of life or make it worse, that you have to decide, and do not delay in starting the treatment, because any smallest symptoms like pain or any other symptoms patient is suffering, do not say now you come after 2 days and I will write you the medicine. It is not the right way to do. The following steps are you have to take before deciding the symptom management. Discontinue any treatment medication which causes symptoms. Like if patient is having vomiting and patient is on a painkiller, the drug is tramadol. Tramadol is likely to cause nausea and vomiting. So, if you know that it is the vomiting is because of that drug, you discontinue that treatment and try another alternative medication. So, palliative chemotherapy causing nausea, vomiting, disease is already progressing which is not responding to your palliative chemotherapy, then discontinue chemotherapy and treat the nausea, vomiting first. Consider disease modifying treatment to control symptoms, like suppose there is a tumor, cancer has spread to the vertebra, spine of the patient, and it is giving it is likely to cause fracture of the vertebra, then giving radiotherapy is very best way to treat this patient. So, consider other modifying treatment. Treat reversible cause, like patient of cancer of esophagus having dysphagia, difficulty in swallowing, should be treated for the first of all fungus infection in the esophagus. They are likely to have fungus infection and because of that they are not able to swallow. So, treat the fungus infection first. May have to use multimodal approach to treat a symptoms. Sometimes more than one technology or medicine is required, like cancer breast patient with painful bone metastasis. The cancer has spread to various bones in the body of the patient. So, they should be treated with the radiotherapy to the most painful bone, then drug to strengthen the bone as well as analgesics, painkillers. So, this is a multimodal approach to treat symptom of the patient. Change in lifestyle, diet, activity, use of aids, etc. If patient is not able to walk without support, ask him to use a stick or a walker. If patient is having patient you have given morphine and he is likely to have constipation, ask him to change his diet, take more fiber, more water and more liquid diet, like that. Proved alternative medicine as per patient's past experience. Suppose your patient is taking some herbal preparation or Ayurvedic preparation for his constipation, and now you are giving morphine and he is having constipation, you can tell him he can continue his herbal preparation. So, whatever alternative medicine he is taking, he can continue if it is not affecting your course of treatment. We will explain this goals and symptom management by discussing a case scenario. A patient with dyspnea, that is breathlessness, due to recurrent malignant pleural effusion had undergone frequent tapping of pleural effusion. In pleural effusion, patient develops collection of fluid between lung and the outer membrane. So, because of that he is becoming breathless. Now, we have to undergo a procedure, we call it pleurodosis, where we inject a drug into this outer membrane and lung, and this drug will reduce this space, it will make it stick to the lung, this membrane will stick to the lung, it is called pleurodosis. Now, he does not more, otherwise we have to remove the fluid frequently. So, now patient is fed up, he does not want to come every time to hospital to remove the fluid, get his fluid removed from the lung. So, we have explained about the pleurodosis. His dyspnea can be treated, but he is fed up of with that. So, his dyspnea can be treated with morphine and other drug. Now, his breathlessness, he does not want pleurodosis, he does not want tapping. So, now his breathlessness should be controlled with the drugs or medicine or some change in lifestyle which he can do at home. Like morphine can be given, other drugs like steroid can be given, and non-interventional management like blowing fan on the face of the patient and upright position like this position, these are the position where patient will feel less breathless. So, explain these positions to them, nebulizer, giving some medicine by inhalation and also technology. So, now patient does not have to come to hospital and he can manage his breathlessness at home. Another patient is with multiple bone metastasis and having severe pain. Patient is having cancer spread to various bones and he is having severe pain. May not agree for this, we give radiation to the bone which is most painful. But since he is staying in a village and he does not want to travel to the hospital for taking radiation, usually we give 3 to 5 doses of radiation to relieve pain in this patient, but he is not ready to travel. Secondly, because of pain also he cannot travel every day for just for taking radiation. Thirdly, his bones are so fragile because of disease. If he has to travel frequently, then he is likely to get fracture. Because of all this problem, though radiation is the treatment required for this patient, you may not give this treatment and give alternate treatment to reduce his pain. So, you can give higher dose of analgesic or morphine and other drugs to strengthen the bone, which he can take at home and he can be at rest or at peace at home. Third, whenever you are planning a treatment, it should be shared decision making. Whatever treatment you have planned, you just do not start the treatment, you have to discuss the treatment options with the patient and family, discuss the benefits and disadvantages, side effects, complication, etc., and then put that treatment into the planning. So, if a patient is suffering from motor neuron disease, that is a nervous tissue disease, and has dysphagia, inability to swallow due to muscle weakness, and whenever this type of patient swallow, their food and liquid goes into the windpipe, we call it aspiration. He aspirates food and liquid every time he eats, but he and his family decide that he choose to enjoy eating and drinking by mouth instead of putting a feeding tube. In this type of patient, we put a feeding tube from the nose to the stomach, and where patient can take liquids safely. But patient and family decide, I do not want feeding tube on in my nose or in throat, and I want to enjoy my eating and drinking even if I aspirate. So, it is their decision, we have to respect them and advise them accordingly. We cannot force our decision to patient. Many a times patients has multiple symptoms. Sometimes patient have 6 to 10 symptoms. Then which symptoms to treat first? First you find out which is the symptom which is bothering him the most. So, treat the active symptoms, most severe symptoms, and treat the symptom with great degree of distress. The symptom which is causing much distress and agony, you treat the first. You should also evaluate whether this symptom is affecting his function or not. The symptom which affects the function should be treated most, like breathlessness. Because of breathlessness, sometimes patient is not able to go up to the bathroom also. So, you try to treat that first. So, at least his one of the function going to the bathroom can be restored. Do thorough physical examination, like where is the pain, whether he is having proper mouth care. Sometimes because of improper hygiene, mouth hygiene, oral hygiene, patient might have nausea, vomiting and not able to eat, skin care, etc. If required, you may ask for few investigation, only if required. Sometimes you have to choose such a medicine that it can act on more than one symptoms, like steroid. It will help in nausea, vomiting also, it will help in breathlessness also, it will help in bone metastatic pain also. Similarly, morphine, it can help in relieving pain, it can help in breathlessness also. So, this is the way you have to choose the medicine. At the same time, lighten the burden of treatment. Do not add any extra burden on patient by telling him that you have to undergo CT scan, for his nausea, vomiting you have to undergo CT scan, for your pain in spine, we know it is bone metastasis, you have to undergo MRI. So, do not add any burden to the patient, and no, must get admitted, your pain is severe. Even severe most pain can be treated at home by giving morphine. So, you have to consider all these points as far as palliative care is concerned. These are the various symptoms you will see in cancer patients. 89% of them has pain. 69% feel very weak, fatigue all the time, even if they go to bathroom they get tired. 66% of them feel weakness, 66% have anorexia, loss of appetite, they do not feel like eating, lack of energy, nausea 60%, dryness of mouth, constipation, early satiation means they cannot eat more amount of food, only small bite of food and they are satiated, full. breathlessness and vomiting. So, these are the various symptoms in cancer patient. If you relieve them, their quality of life improves and they are able to live whatever days are left, they are able to live better. Along with symptom assessment, psychological assessment is the important as far as palliative care is concerned. How patient is managing with all the problem. Suppose he is having vomiting with solid food, is he able to manage with the liquid diet? Suppose he is very much breathless while going to bathroom, is he able to manage that function in the bed? So, all this type of coping mechanism you evaluate. And what are his, see when suppose we are suffering from a severe headache and it goes on for day 2, day 3, day 7, then there are so many things will come in our mind. Is there a tumor? Have I got meningitis? Is it curable? What will happen to me? And so much. So, these patients, cancer patients or with chronic illness patient, they have suffered for many months and days, and these are the fear, their concern about fear, anxiety, sadness, depression, and that can lead to insomnia. So, evaluate all these psychological aspect of these patients. Whenever you decide a drug, be very specific. This patient, they are on treatment since long time, they are fed up of taking multiple drugs and medicines and all such thing, and it affected their financial burden concern also. So, before deciding any drug or treatment, be very specific. Is it necessary for this patient? Can he afford it? Can he tolerate it? Also think, just do not write a long prescription and as you write in other diseases. So, be specific about drug, its dosing, its timing, route, and keep it as simple as possible, like keep it oral medication as possible. He can take at home, his caregiver can give this medicine at home. If you prescribe injection 3 times a day to be taken for 7 days, patient will have to manage so many things at home. He has to call some nurse or some healthcare worker at home and they get the medicine and get the injection and all. So, keep the drug, all this treatment very simple. So, the compliance of the patient is maintained. It is better to start one medication for most bothersome symptoms and make some progress. Sustained release formulation are often useful. Sometimes drug which are acting for longer time is preferred, because then patient has to take only once or twice a day. If it is simple immediate release preparation, patient has to take frequently. Cost effective is very important. Nowadays, with the availability of the generic drug, most of our problem is solved. Attempt to use one drug that may address multiple symptoms, as we discussed earlier, like dexamethasone. It is a steroid, can be given for effect pain, appetite and breathlessness. Alternative medicine can be tried if patient has got faith in yoga, pranic healing, meditation, he should be able to do it, and change in diet plan, which is again very important. Use rescue dosing. Rescue drugs are one, suppose you have given a medicine for vomiting, but in spite of that intermittently he gets one bout of vomit. That time he can take one medicine, it is called rescue drug. So, rescue drugs are important for expected symptom exaggeration in those on sustained medication. This approach increases the efficacy and minimizes the adverse effect. And rescue medicine is the same medicine which is you are giving round the clock, like morphine. If you are giving round the clock morphine for pain management, but intermittently patient when gets up or sneezing or and sometimes he gets severe breakthrough pain, then he can take one extra dose of morphine to relieve that pain, that is called rescue dose. For example, a prescription to treat nausea may read metoclopramide 10 milligram by mouth before meals and at the bedtime every 4 hours as needed to treat nausea and vomiting. So, as I said, this is the drug given for vomiting. He can take one extra dose of this drug whenever he has extra vomiting. Before planning any treatment, any medicine, you must consider patient age, fragility, how fragile he is, cost of the drug and anticipated side effect. Many of the cancer patients are cachexic, they have very much reduction in body mass, reduce weight, and cancer is a disease of old age, they are elderly also. In this patient you have to decide the dose of the drug according to the patient's fragility and patient's age. So, they need very small dose. Oral or transdermal preparation are preferable to parenteral ones with regard to convenience. As I said, instead of injectable medicine, give oral medicine or patch. Now, many medicines comes in form of patch to be applied on the skin of the patient. Of course, these are very costly medicine, but still if patient is affording and he is not comfortable with oral drug, like patient is having continuous vomiting, case of cancer of stomach, then we have to go for the transdermal preparation. The patch is applied on the skin instead of giving injection. He cannot manage injections at home. But if injection and parenteral dosing is necessary, the subcutaneous route is also preferred, where even a nurse or a healthcare worker can put a needle under the skin and give the injection. Most important in palliative care, do not give any medicine which is not effective and which is not necessary. So, if patient is taking such medicine given by some other physician or doctor, discontinue that. Give minimum number of drugs as possible. This will enhance their compliance. They will be very regular in taking their medicine if there are only few medicine to be taken. So, make one change at a time. Suddenly you do not discontinue all the medicine and start new, not discontinue few, add few. For any new symptoms, discontinue the previous medicine and add some new medicine for new symptoms. Reassess often. As I said, assessment is a very important, not only at starting of the treatment, but in between treatment, at the end of treatment or during the course of treatment, you have to reassess the patient, its symptoms and status of the underlying disease. In summary, when you are treating symptom of a patient, show empathy. You are with them. You are always there to support them and treat them whatever problem they get. Understanding, elevation of mood are essential adjuvants and drug are only part of overall management. Sometimes simple change in lifestyle or diet can improve the symptoms instead of giving 1 or 2 drugs continuously. So, what matters most in palliative care is your relationship with the patient, carer and healthcare professional. So, What we are aiming by giving palliative care is a holistic health where patients' physical, emotional, mental, social and spiritual problems are taken care of. Thank you very much.